If ketamine infusions are so great, why aren't more doctors providing this service? There's three main reasons for this. Number one is awareness of this as a treatment option. Some doctors do not stay up to date on the latest evidence, and as a result, they don't know the cutting edge research that is happening in this space. So, for example, there's 140 plus clinical trials looking at ketamine for various mood and pain disorders. Number two is comfort with administering this medication. Typically, outside of emergency medicine and anesthesiologists, a lot of doctors are not trained specifically in the use for procedural sedation. So they may not be comfortable or even familiar with how to use it technically. And finally, number three is acceptance of this treatment. Ketamine, it's pretty cutting edge, it's novel, it's new. And as a result, the awareness and acceptance may not be fully there. When we opened 6 years ago, ketamine was pretty new. I was one of the first ketamine clinics to open up nationwide, and now there's more. So the awareness is increasing, but still, things can be slow to change in medicine. How am I going to feel after a ketamine infusion? Typically, we allow the patients to rest and recover for a good 20, 30 minutes post infusion, and then have a debriefing session. Some patients may still have the effects of ketamine, even though the IV may be removed and pretty long lasting, which is one of the reasons why we don't suggest anyone drives for 12 hours post infusion. Some patients may also report feeling, some mild nausea or headaches or fatigue. Think about it. Someone has gone on a long journey and, when you get back from that journey, you can feel fatigued and tired. So we suggest that our patients rest, take it easy, relax, no social media, no news, really maybe even just taking a nap to chill out and let the brain recover. I kind of think about it as shaking up a snow globe really hard. And now the little snow pieces are all in flurry and you just want to let things settle down into its natural state. What should I wear on the day of the infusion? Well, we are going to be placing an IV, typically in the hand or upper arm. So we want to have easy access to the upper extremity so that we can, find the vein easily. Also, we're going to be putting on electrodes on the chest and abdomen. So something where we can access it, maybe like a loose button-up shirt. You want to be really comfortable. And that might look like literally wearing pajamas, very loose, relaxed clothing, nothing tight or restricting. Maybe not a lot of jewelry or earrings because we will be putting on headphones. So the real bottom line is comfortable, loose, something where you're going to be able to lay back and chill out for, a period of time. Can I drive after my ketamine infusion? The answer is no. And at least for 12 hours post infusion, you do not want to drive, operate any heavy machinery like a forklift for whatever reason or a golf cart. You may also not want to have a lot of things on your plate, maybe caring for your little kids or doing some important emails or Zooms. You just want to really relax and rest. The ketamine half-life, typically at around 12 hours, the 98, 99% of it will be out of the system. So that would be fine. But we usually recommend don't drive until the next day. Remember, you have received a powerful medication, may have gone on a pretty intense journey. So you really want to rest, recover. And sometimes driving can be strenuous, especially if you're in California. There's a lot of traffic, a lot of stop and goes. So really avoiding things that are going to mentally and physically tax you. Do I need to stop any medications that I'm taking? Well, some of the medications that can decrease the effectiveness of ketamine therapy are lamotrigine, aka Lamictal, and benzodiazepines. So for example, that includes like Ativan or Xanax or Klonopin. Some of those medications can decrease the effectiveness. So you kind of want to get the most out of the ketamine therapy by talking with your prescribing doctor about either reducing or tapering those medications. Now, sometimes if someone does have some anxiety during or before the infusion, we will push just very small amounts of benzos, and that seems to be okay. But the important thing to remember is to never stop any medication, especially psychiatric medications, cold turkey, because it can lead to some severe side effects. For example, if someone abruptly stops benzos or lamotrigine, that can cause a host of side effects, seizures, you may end up in the ER. So remember, do not stop any of these medications without consulting your doctor. Who shouldn't get IV ketamine therapy? I.e., are there any conditions that make ketamine dangerous or ineffective? Some of the contraindications for ketamine therapy are uncontrolled blood pressure, unstable heart disease, i.e., if you've had a heart attack or experiencing chest pain or shortness of breath with exertion, congestive heart failure, cardiac arrhythmias, untreated thyroid disease, the active substance abuse, active manic phase of bipolar 1 or 2 disorder, because it can actually increase mania symptoms. Untreated glaucoma, there's a theoretical risk that it can increase intraocular eye pressure. Active delusions or hallucinations, or even a history of schizophrenia can be a contraindication, possibly. So if you have any of these on the day of the infusion, you may not be able to get your ketamine, or may not even be a candidate for ketamine therapy. What is the response rate to ketamine therapy? Well, every single patient is different. Studies are showing up to 70 to 80% will have symptomatic improvement, i.e. 50% or greater reduction in their depression score, anxiety score, PTSD score, pain score, etc. So typically, we'll do a series of 6 infusions, and then that's done in a short period of time, roughly 2 to 3 weeks. Once that is done, some patients do get booster infusions, which may occur once every 1 to 3 months, roughly, kind of depending on their symptoms. What I have noticed is that the more someone is engaged and making active lifestyle changes, which may look like exercise, meditating, journaling, talking with their therapist or integration coach, um, taking a break from social media and news in particular, like all of these little things can impact the ketamine duration and durability of the effects. So ketamine is one tool, can act as a catalyst, but the real key is that integration piece to get the most robust effects post ketamine. If ketamine therapy is working for me, how soon will I begin to notice a difference? For some people, these positive benefits and results can come pretty dramatically, maybe within hours to days after even one infusion. But typically, it requires more infusions, which is the reason why we do 6 ketamine initial series. So some people will be responding at session number 5, session number 6, session number 2. It's pretty variable. So to know that sometimes someone needs more infusions. And at least at our clinic, we actually alter and change the dose, typically increasing it slightly with each infusion until we get that Goldilocks amount. Sometimes the effects can be rapid and huge. Other times it can be gradual shifts in your consciousness. And again, every patient is different. So being patient with it, doing the integration work in between the sessions, i.e. the homework, can be really beneficial. And what you'll notice is that with more improved function, that'll actually lead to what I call a positive, virtuous cycle to really maximize the benefits of ketamine therapy.